showing you today the proper use of your sling post-operatively, and also going over some anatomy related to total shoulder arthroplasty that'll make it more understandable why we need to restrict your motion with a sling directly after surgery. And this is going to be the best way to keep your shoulder safe in the immediate post-operative period. Remember to comply with all instructions that are given to you at the time of surgery, both preoperatively and postoperatively, as well as the instructions that are given to you by your physical therapist. If you have any doubt one way or the other, please feel free to call the office at any time. Okay, so I wanted to give you a reason why we put you in the sling postoperatively, and to understand the biomechanical forces that are at work that make it so important. So if you take a look at the shoulder, here we have the subscapularis muscle, so we're looking from the front. And as you can see, the tendon of the subscapularis muscle obscures the articulation between the humerus and the glenoid, which is the socket of the shoulder. So in order to gain access to that compartment during a total shoulder arthroplasty, you need to remove the subscapularis tendon, or move it out of the way rather. And this involves either taking a small fragment of bone or peeling the soft tissue away to open it like a door. At the end of the operation, it's equally important that we close this tissue to restore your ability to internally rotate your arm. Of course, this repair site is at risk during the immediate postoperative period. The sling that we put you in positions your arm in an internally rotated position, thus shortening the distance between the muscle belly and the insertion of the tendon. This removes the stresses across the repair site and allows it to heal properly. Okay, so here we are. I've been placed in the sling as you will be after surgery. All the straps and the torso band will be adjusted to your personal dimensions. It should be very comfortable for you to wear. The next thing we're going to discuss is how to take off the shoulder sling. This is going to be important for doing hygiene as well as for completing the therapy exercises that are prescribed to you. The first step in removing the sling is to take a seat and position your forearm against your leg such that it's well supported in the seated position. The next step is to remove the enclosure strap right here. It's usually easier than that. And to remove the shoulder strap next, to unclick here, bring around the head with your other arm, and then insert the clip into the other for easy reapplication later. Then adjust the strap for the enclosure itself to release it, and reach into the sling, keeping the arm well supported, and using this arm to remove the other arm from the sling enclosure. Bring your arm across your body and rest on the torso strap. When you come to the standing position, you'll notice that my arm is rested against the torso strap. Now I'll use the contralateral arm while still supporting the other to unstrap the torso, place it on the table, and now I'm out of the sling. Okay, so now's the difficult part, getting back into the sling after you're done doing your hygiene or your physical therapy exercises. In this video, I'm going to try to show you how to get back into the sling when you don't have somebody to assist you. Usually it is quite a bit easier and recommended to have somebody to assist you in putting on the sling, but if you get yourself into a situation where that's not possible, this is how you're going to be able to get it on. So the first step is to make sure your sling is properly arranged on the surface where you left it, with the sling straps outstretched. Now you're going to take a seat on the table, keeping your arm supported against your leg like it was when you took off the sling. And now you're going to take your other arm and you're going to help bring this across and onto your torso where it belongs, with the belt buckle in the facing forward position. Now just applying light downward pressure, or allowing the arm to rest on the torso strap, you can keep it in place and take the other end of the torso strap and bring it across your body. Sometimes it's necessary to cinch it up a little bit higher in order to get it into the correct location. You can see it click in there, and you'll get really good at this as time goes on if you're doing this quite often. Then take your other arm, as you did before, supporting the shoulder, and you're going to be using a little bit of that operative shoulder muscle in order to direct it into the sling, but it should definitely be being helped by the other arm for the majority of forceful movements. So you just open up the sling pouch and allow your arm to glide into the pouch, opening up the back so that your elbow slips in to the notch at the back. Then tighten it up against the arm, and you're going to take the shoulder sling from the other side, and you can get to it right here if you positioned it correctly beforehand. And we take this and bring it across the shoulder, just like the opposite of how we took it off. Kind of lean into it, position the strap in the correct location, and snap into place. Now your arm is fully supported. Readjust the envelope and apply the closure strap. If there's any slack remaining at the wrist, you can pull it out with this device right here that you loosened before, and now you're back in the correct position. You can go about your day.